Okay, so I want to talk about migraines and PTSD. Is there a correlation? Yes. You are at greater susceptibility, increased risk of developing chronic migraines if you have PTSD of any variation. Complex PTSD, classic PTSD, right? It makes sense when you think about classic PTSD, combat veterans in war situations, and a TBI, even a mild concussion, traumatic brain injury, TBI, is going to increase the risk of chronic migraines down the road. That makes sense, right? The brain being shaken up by some explosion going off nearby, of course that increases the risk of chronic migraines. Right? Makes sense. Although an interesting connection in an article I found, basically, right, the incidence of migraines, chronic migraines, is more common in women. The incidence of PTSD is also more common in women. They're not sure why. Possibly it's due to the fact that women are at greater risk of, they have higher rates of interpersonal trauma in their lives than men. Don't hear me invalidating the traumas that men experience. I'm just giving you the numbers based on the research that interpersonal trauma happens more often to women. So I think the numbers are something like 2-to-1 or 3-to-1, depending on which point in the lifetime you look at in terms of the incidence of PTSD in women versus men. But here was an interesting finding that came out of this study, and I'll link to these studies. I'll put them in the description box below so you can find them if you want to go read them. This was done by the NIH, and the title of it was Post-Traumatic Stress Disorder and Migraine, Epidemiology, Sex Differences, and Potential Mechanisms. They correlated that if you're male and you have PTSD, then the correlation to migraines is actually stronger than it is in women, and they're not sure why that is. It's interesting given how both variables, PTSD and chronic migraines, are more common independently of one another in women. But yet, if you're male and you have PTSD or complex PTSD, I'm lumping them all together, then you are more likely to develop chronic migraines even than females, based on your gender. Taking that piece and then tying it into another study I came across, you will find this interesting, I think. I was super excited to find this study on traumatic experiences, stressful events, and alexithymia in chronic migraines with medication overuse. So this study, instead of labeling it PTSD, talked about traumatic experiences and stressful events. And then this third piece, alexithymia, I wasn't familiar with this term. I don't know if it's a new term since I went to medical school, or if it's... Anyways, this study came out in 2018, and alexithymia refers to specifically difficulty in terms of emotional awareness, which is the ability to identify and recognize emotions in oneself and in others. This I found extraordinarily interesting because it's a risk factor, an increase in risk in not just with chronic migraines. Actually, it's more strongly correlated with if you have chronic migraines and you have this additional trait of alexithymia, which likely comes out of PTSD in childhood from adverse events, where you learned to misread number one, the feelings of others, or the emotions of others and your own. Again, because I've spoken about that on this channel, the interoception versus the exteroception pieces getting imbalanced and thrown off, and somebody spending a disproportionate amount of time trying to read the emotions of dad who's drunk. Alcoholic dad comes home, and the little kid is trying to put the pieces together as to when it's a scenario where dad beats them and when it's a scenario where dad buys pizza and they play board games around the table. And so in that context, a kid misreads emotions and ends up developing, all sorts of personal correlations that seem to be what's happening. He's conducting his own research. Well, when dad does this, then that means this. And then ends up, the consequences of that are later in life, then misreads emotional cues, right? And so here we have a link with lack of emotional intelligence, lack of emotional literacy, and the development of physical illness. They're correlated. If you don't deal with the one, the consequences are you end up with more of the other. I found this extraordinarily fascinating and interesting, and has all sorts of implications for what we're doing in the field, in trauma. I've said it before and I'm going to say it again, we have to address things holistically. We cannot just look at the physical, which is, more or less what's happening most of the time in conventional medicine. Because things are so specialized and so separated out, you have someone who will give you a medication for your migraines. That's likely to be Imitrex. That's, a tryptin drug. And it basically, if you take it with the right timing, is supposed to abort migraines. So you do that, but if the migraines are related to the PTSD, then you're missing half the equation. And as it turns out, there's a strong correlation between the two. And so in this particular study, the correlation was, I want to be careful that I explain this to you. It was not necessarily with the alexithymia and the emotional awareness piece being associated with the chronic migraines, but rather being associated with chronic medication overuse with the chronic migraines. And so pain syndromes, for example, are known to be associated, that's in the research going back, with alexithymia. Meaning, if there's a lack of emotional awareness and recognition of identifying feelings, then the tendency is to over-medicate in that particular individual. That's the correlation. And so then you can see where lots of other things down the road might further spill out of that. You might have chronic pain syndromes developing. You might have fibromyalgia developing. You might have and even they looked at how there's a misreading of bodily and physical cues associated with the lack of reading of the emotional feeling cues. So an argument to be made for emotional literacy affecting your physical health and how you experience pain. If it wasn't enough of an argument to deal with your feelings and your emotions, here's a physical argument for why you should invest your time and your energy in understanding you're in developing emotional literacy, emotional intelligence. These matter. So that I found highly fascinating. There are a couple of other studies that I'll talk about probably in future videos, but a couple that, I mean, the mechanism for all of this crossing over, I'm always interested in that. And some of that is likely HPA axis, anomalies, changes, also genetic polymorphisms as a result of the BDNF gene expression. And so you end up with, the Val66 MET gene polymorphism, which is the most well-studied BDNF polymorphism, as far as I can tell. That contributing to migraines, actually. So there's a lot of interesting stuff out there. Thanks for tuning in. I don't want to go on and on, as I have a tendency to do, but exciting stuff. And all that to say, just to reinforce the fact that when you're thinking about trying to heal from all of these pieces, do it holistically. Address the mental, emotional, psychological, spiritual, and the physical. And hopefully, do that together if you can. Thanks for tuning in. Audio.